patients come to me often for years, and this is done across the country, really across the world. People come in, they see me for a consult, they get a surgery date a few months later, and there's very little interaction, and there's very little treatment that I offer them in that interim. And surgery is a really invasive
Very invasive
event,
yes.
and I don't like to say that, and I
Yes.
certainly don't want patients to feel that, but the truth is it's very traumatic. Surgery is very traumatic for the skin. And we've talked about this concept of keeping things hydrated, well hydrated.
Yes.
Nutrients to the skin, limiting oxygen-free radicals, etc. Things like that become so important to the actual event. And then in the healing process, I mean, edema, we've talked about this. One of the areas that's very frustrating for me and very frustrating for patients is the swelling that can persist, in addition to the whole face, particularly here under the eyelids. And patients can feel like they almost took a step backwards before they look better. Or down here in the neck. And Aida has some incredible techniques, both manual and in terms of some of the serums she talks about to just promote lymphatic drainage. It's getting the fluid to the lymphatic system.
Yes.
And when you can limit swelling.
Yes, when you can limit swelling, then you have less bruising, you have less irritation, you have less swellness. But this is really well-known process in France. It doesn't do well in America. Why? Because it's not instant gratification. And we are inclined to instant gratification in America. I want it not tomorrow, I want it today, the results. And instant gratification in the long run is not the good results. So that's why we came together that we gonna work together for best results before, to prepare the skin before the surgery, and to heal the skin after the surgery faster, less traumatic, and better skin condition.